Ladies and gentlemen, welcome to another exciting episode of Therapy Tea Time Talk. We have a very honored guest coming up onto our show today, a great physiotherapist from Taiwan who is actually a clinical founder of his own private clinic. His name is David. Welcome to the show, David.
Hi, everyone.
Thank you for taking your time to come up to our show today, David. It's lovely to have you.
Yep.
All right. So to start with this interview, we've got a couple of quick questions to ask you here today. So starting with this one. So tell us a little bit more about you. How did you get started in this profession, and how long have you been doing it for?
Okay. I graduated from the Physiotherapy school in Taiwan. That's the biggest university, the National Taiwan University, since 2005, and I after graduate from the university, I studied in the master's degrees, and also I do the physiotherapy works in a small clinic. And for after 2 years, when I graduated from the graduate school, and I go to the biggest hospital in Taiwan, the Veterans General Hospital in Taipei. And then after 3 years, I think the physio work is really boring for me, because in the hospital, so I decided to quit from the hospital, and I start my editorial manager work in the publisher as a medical editor. Okay, and that's a very fantastic experiences, because I learned a lot from how to communicate with other specialties in the publisher. And after 2 years from that work, and I quit again because someone has recruited me to his private clinic. And so after that, I went to that clinic, and from my private self-pay work, maybe 10 years ago, and so I do the self-pay work for 10 years from 2 clinics, my boss's clinic and my clinic. So I really I think a lot of business like me, we do the business works and for I think for a long time, but we got bored. Okay, when we found that I have no idea how to treat such clients. I have no idea where I can get advanced, so I quit from Physio. But interesting is that at that time I do a lot of cardio rehabs. But when I went to the publisher, I learned a lot from other specialties. So I started get interesting in the myofascia and the myofascial meridians and the manual techniques, how to treat the fascias or the muscles. That's really not what we learned in the school, because in the school we learned a lot of impairments, we learned a lot of diagnosis, something like the tennis elbows, the adhesive capsulitis. But when we get into the fascia terms and we get into the fascia words, I found, we can treat the function, not just treat the diagnosis, not just treat the disorders. So that's interesting for me. So I learned from a lot of systems how to analyze the motions, how to really get the myofascia soft and working functionally, and then get the corrective exercise for the clients, the patients, and make them stronger and pain free. So that's what I do now, and what my clinic purpose now. Yeah.
So in terms of your clinic so in terms of your clinic specifically, so do you specialize in doing like musculoskeletal type of work or like sports injuries?
Yeah, actually no, because in Taiwan we have no such specialty. So I fly out to a lot of countries. Like I fly to Michigan State University to learn how to do some musculoskeletal treatment skills, muscle energy techniques, myofascial release, corrective exercises, and thrust manipulation, something like that. So yeah, we don't have a specialty or program in Taiwan that we can get into something like the musculoskeletal or cardiopulmonary. No, yeah. So actually, I learned a lot of things from other countries, not in Taiwan. Yeah.
So in terms of your methods of like diagnosis and treatments, because based on what you just told me, it sounds like that you have a handful of different experience in other learning from other professionals as well at the same time that allows you to become who you are today. How do you think your methods have changed over the years?
So the first is that because I learned a lot of things from the college, the student when I was a student, so I used the methods to treat my clients or my patients in the hospital. But I found that's really complicated because I need to do a lot of assessments, a lot of tests, and a lot of treatments, but get not really good efficacy. So I think maybe from 13 years ago, when I firstly get a fascial meridian concept, and I read the whole book about the fascial meridian concept, and I use that to treat my clients in the hospital. And that's the first time I really get one person joints, links, not just a joint by joint. Okay, so that's the first time I think I assess a person functionally and movement links. Okay, and about 2 years after, as I mentioned, that I was bored from the work, because I still can't get one system that really quick and easy and logical for me to get into one's functional problems, the dysfunctionals. So I quit and I get into the publisher. But after learning a lot of things from other fields, other specialties, and I decided to again get in my physio works about 10 years ago. Okay, so 10 years ago, I'm back and go to my boss's private clinic, but I'm still searching. I'm still searching for a system that can really get me to quickly understand one's functional or dysfunctional, or functional problems or dysfunctional. So I learned the functional movement screen and functional movement assessments from the course in the United States. Yeah, and I integrate them into my fascial meridians. So that's a really cool thing, is that if we do some movement pattern assessments and we link that to the myofascial meridians, it means that we can treat the functional, the myofascial meridians if you get the dysfunction. And after the treatments, they get very good functional improvements and good mobility works. And after that, we can provide some corrective exercises. So I get to learn the corrective exercises again from other systems. Yeah, because when I do some myofascial works, I found you can touch your toes now. You feel better for your back pain now, but you still can't maintain that. Okay, so I need to make you stronger. I need to make you doing better. So I learned the correctives from other systems, and so now I integrate the correctives into the motion analysis systems, combine myofascial meridians. Okay, so that's a very cool thing. You do the motion tests, you treat the myofascial meridians, and you give the corrective exercises to make them doing good and better movement patterns. So that's what I do now. Yeah. So I changed it a lot. I think it changed a lot because from the very beginning, I just treat your joints. So if you feel your shoulder pain, you've got a shoulder pain, and I'm trying to do some works like mobilizations, and you feel good for your shoulders, but you still don't know how and how long can it be lasting, right? So now I can tell my clients that, yeah, okay, so I treat your fascia and I give you some correctives, and you can maintain how many days or how many weeks, but you still have to do something to maintain that. So that's a very cool things that I can give a really precise days or weeks or works that you have to do. And interesting thing is that after that, I get a lot of information from the trainers, personal trainers or coaches. They told me that, maybe we can cooperate with something. So I can, you can refer your cases to me and I can train them. And I think, so I need to know how to do the loadings, how to do the capacity exercises, because we know a lot of people now in the gym that they are doing their weight trainings, but we still don't know what they do. So maybe 3 or 4 years, I think maybe 3 or 4 years ago, and I get into loading courses and learn how to do the weight training, the deadlift, the weighting, the loading squats. And so now I cooperate a lot of trainers, and I refer them the clients we treated, and we found that it's a really good course from medical diagnosis and the treatments and the functional regain, and after that the capacity loading. So that's, and the patient, the clients are all now very healthy and good and maintainable. So I think that's what I do now. So that's a very big change. Yeah.
I think it sounds fantastic because it sounds like you've transitioned all the way from what you described earlier to liaising with other professionals in other areas to continue providing the patient in terms of what they need for them to maintain a good functional health. Is that correct?
Yeah.
I think you also mentioned about time in your sessions before as an issue before. So may I kindly ask roughly how long is each of your sessions right now with your patients?
Okay. I always, every visiting will be 50 to 60 minutes. Okay. So it will be 50 to 60 minutes. And I usually use the 10 or maybe 15 minutes to get the history. And I always got some precise history about the trauma. That's the I think that's a routine process for every physios. Yeah, because we need to get a very precise trauma histories, surgical histories, or some red flags that showed in the history. And after that, maybe 10 or 15 minutes for me to do the assessment diagnosis, what the functional is, or how the functional is, because I always get a referral from the doctors. They give me one diagnosis like this disc bulging or meniscus tear. That's the structural diagnosis, right? But I have to do my works, because what I have to do is to try to make you functional. Yeah. So I will do the functional tests to test what is your dysfunctions. So that's totally different from the diagnosis from doctors, because they might use the ultrasound imaging to check something, but I use the motion analysis to check your function. And after that, I will spend maybe 13 to 40 minutes to treat the patients. Yeah.
So it sounds like there's like a collaborative role between the doctor and you as well, right? So they first do the structural diagnosis first, and then you assess the function. Because as a physio, I think you also help as you have mentioned, you're also trying to help the person to improve their function and their health through exercise as well. Is that correct?
Yeah, sure.
Yeah. Okay. So I was wondering also then, in terms of your sessions, what about the distribution of the time? Let's say, how long do you do the actual assessments for, and how long do you do the treatment portion for?
Okay. For the assessment will be 10 to 15 minutes, as I say, because I developed my own thinking process. So I do some functional tests will be logically and shortenly. So if you got a good pattern, I will skip the whole part tests. Okay, so I won't test everything detailed unless you got a dysfunctional movement pattern. Okay, so that really shortened my assessment periods. Okay, the time. And so I save more time to treat patients. And for the patients, I always separate them into two subgroups. One subgroup is the mobility subgroup, and one subgroup is the motor control subgroup. Why I separate them into such two groups is because if you got a mobility problems, I need to perform a lot of maybe myofascial works or joints use like mobilizations, manipulations, muscle energy techniques, something like that. So I separate them into two groups, and after I did the myofascial works, joint works, and they become better in mobility, and then I will test the motor control dysfunctions. Which is that they got a range, but they can't control the range. Okay, so if they can't control the range, I will find how to activate the muscles, activate the motor patterns, activate the neuromuscular connections. So that's really important for those people who get re-injuries. Okay, so if you just give the myofascial works, maybe you spend a lot of time just doing the manipulations, myofascial works, but you still got re-injuries. That's not a cool thing, right? Okay, so I did the myofascial works or the joint works, and I give them the correctives, or what we call the corrective exercises. And after corrective exercises, I want them to maintain the motor pattern, and even they can bear some weights. Okay, bear some weights. So I have them to my cooperative trainers to do the weight training. So that won't include in my session, but I will explain these things to my client. So maybe 5 or 10 minutes after 2 or 3 sessions, I found, yeah, your myofascia is okay, your joint is okay, and you can now do the very good motor patterns, but you still need to get some weights so that you can be stronger. So I will introduce them, the trainers, and how to get stronger. And if you still feel pain or feel some dysfunctional, you can get back to me and I can cooperate very well with my trainer. But if I found something wrong, like if I treat your fascias and I treat your joints, but you still feel pain, or you do a very good range, but you still feel pain in the end range, that means some structure might be damaged, right? So I will refer them back to the doctor. So it become a very good circuit that people can get good treatments and training in doctors, physios, and trainers. So you spend maybe 60 minutes for me for a session, but actually I spend maybe a lot of time to mention them why we do this. Okay, yeah.
So in that case, would you agree that patient education plays a very, very vital role?
Yes. Because you have to know why you are here and why you are referred from your doctor to me, or why you are referred from your trainers to me. So I can do my works, but I can't do your works, right? So you have to do your works, and I do my fascia and joint works. And if you have to be weighted training, okay? So you got to the trainer, if you have to do some regeneration therapy, maybe you like surgical repairs or like some injections, maybe you have to get back to the doctors. Yeah. So you explain everything and you've got a very good efficacy. Yeah.
Okay, sounds fantastic. It sounds like that there's actually a great collaboration between, you, the trainer or exercise physiologist, in addition to the doctor team as well, which is fantastic. And thank you for providing us with such a high degree of detail in this area as well, in terms of what you're involved in this area. And what I wanted to ask now is, do you have any advice for people that are new in the field of physio, or who are just looking to get into physio?
Okay, that's a very interesting, and I want to share is that when I graduated from the school and I worked in the hospital and I treat a lot of patients, and I found the efficacy is not really good. So I think that I have to learn a lot of things from other sides, maybe other courses, and after the learning journey, at the end of the learning journey, I found that actually the people who teach in the continued medical educations or other courses from other sides, they are really just teach the basic knowledges and advance the basic knowledges, like what we have learned, the kinesiologies, the anatomy, the physiologies. So what I want to say is that if you can just work hard with your basic knowledge when you learn from the schools, from your teachers, that would be very, very good to advance your skills, not just to find something what we call our courses is the best one, and you learned, but actually they just use the best knowledge. And if you really work hard with your best knowledge, that would be good for you to advance yourself. Yeah. And also one thing I need a new one to know is that we always call it evidence-based, right? We need to do something evidence-based, but don't forget to open your minds to learn things from those really good and effective, but not really evidence-based. You may be not to announce that you use such skills to treat patients, but always learn something new and integrate the new concepts into your clinical practice your clinical process. That would be good for you to every time with your colleagues, new brainstormings, new courses, new concepts. That would be good for you to advance your skill too. Yeah.
All right. Is there anything else that you wanted to add for us today before we come to the end of the show?
So far, no. But I want everyone to know that Physio is a very good motion analysis, right? Yeah, because we physios, you and me, we would like to really analyze one person's motions and give them a diagnosis as a functional diagnosis. You are dysfunctional. Why you are dysfunctional? How we treat your dysfunctional? Not just to treat your cervical, your facet, your disc. Yeah. We want to treat your functional problems. So I want everyone to know, and you keep this so you are not get conflict with other specialties. Like, no, I want to do the diagnosis. I want to treat. I want to train someone. Yeah, we are trying to do a very good motion analysis, so that we can discuss with our doctors why we think that dysfunctional patterns would result in the disc or the ligament tears, or we can discuss with the trainers why our clients use such motor patterns will get injured or pain. Yeah, so that's I think that's our responsibility, and also that's our value. Yeah.
Thank you for that very comprehensive breakdown. I think I like the way how you mentioned about the function aspect, because as physios, I think they're actually highly involved in helping the patients when it comes to getting back to doing their regular normal activities, right? Which requires a lot of function, right? This could be like from sitting, standing, depending on which where at the stage the patient is, right? So we're trying to help them to reintegrate them back to the daily lives, right? And exercise is also a part of what they do as well. So therefore, these goals are also highly dependent on this area. And as physios, I think you're also at the same time, if I'm correct, you're also a movement specialist as well, right?
Yeah, sure.
Movement as well. Yeah, all right. Well, thank you very much for coming on to the show today. It's lovely to
have you.
Fantastic. Again, thank you everybody for tuning into our show today. And again, this is Therapy Tea Time Talk by Physileap. And I hope you all have a nice day.
Have a nice day. Thank you to everyone.